chapter 14 and chapter 16.
I don't know, I'll try.
So the first part, it's number 23. The first part is going to be the nerve. I don't have a, you're going to get that from the diagram. Endoneurium, fascicle, epineurium, perineurium. Those should be easy. Oh, can you grab, can I get a brain? Let's see, can I get a brain? Sometimes, this is not the most, let me see the other side. The other side. There we go. Oop, that's the same side. Can we get a non-pituitary side?
Here it is.
They're all pituitary. That's going to be better now. That's what we have. How does that sound? All right, so what we want to do is those cranial nerves. What's this first one?
Olfactory.
Olfactory. And then the next one is going to be, remember, starting in the anterior, working in the center. What's this one? Olfactory. And then the next one?
Optic.
Optic. So 1, 2, 3, right here. 4, 5. What's the fifth one?
Trigeminal.
Trigeminal. 5, 6, 7. I don't know if you guys can see this. So what you're going to do, 1, 2, 3. If you guys can see this. 1, 2, 3. 1, 2, 3. 4, 5. Okay. The round one, the fifth one, I like to use that as a sort of a jumping point because it's nice and big. Trigeminal nerve gives all your chewing, facial muscles, that sort of stuff. So that's 5. And then if that's 5, what's that? What's this one? 6. And then what's the one next to that? 7. What nerve do we have to do?
Facial.
That's the facial. So on the practical, you have to do 1, 2, and 7. So what I like to do is 1, 2, that round one is 5. Can you see that? 6, 7. You see that? 1, 2, well, I'm going to just jump down to 5, 6, and then 7. Got it? 5 is the big round one. 4 is here. 3 is there. 2 is there. 1 is there. So 1. Okay. So 5, 6, and that one in the middle, right there. 7. So always start in the center, anterior, count your way down. So the optic chiasma is what's going to happen. Here's one optic nerve, here's another optic nerve, and they're going to actually cross over. And remember how I said sometimes in the decussation they send impulses to the other side? With the eyes, it's the same way, is that some of the information goes to my right occipital lobe, while some information crosses over to go to my left occipital lobe. So as protective, if there's an injury or something, or there's a problem, a nerve conduction problem. Okay, so, and we're going to also need a spinal cord. There's one, right, can I borrow that one right there? All right, so I'm going to sort of go a little bit out of order. Which is the posterior? The side, and I can see by my posterior root ganglions. So what are these things? What are these things coming away? Those are the roots. Roots. And which are the, what roots are these?
Posterior.
And what roots are those?
Anterior.
And then we already know about the posterior root ganglion. I'm not thinking that we re-ask you that. And then when the two things come together, I'm going to try to do it. Right where they come together, see where my finger is? What's that called? And then they split. You see how these two split? One that goes to the posterior. This one is to the posterior where my fingers are on. It's going to the posterior. That's called the posterior ramus, or rami. Rami is plural. And what is this? Anterior. Okay. So roots, spinal nerve, just a little part of it, and then it splits out into rami. Use your context clues to get the posterior. Dorsal and posterior are the same thing. Ventral. Okay, I'll accept either one. It's on here as posterior and anterior. Let's see. Did you take that? These things, what I just want to do is go over the plexuses, not really the extra branch, all the extra branches right now. So these are all, what are all these nerves? These are all spinal nerves. The ones that came off here are all cranial. Those are 12 on here. How many pairs are along here?
31.
Okay. So sometimes, right in the cervical region, sometimes they crisscross over for protection, so you can get to school another way. What is that one that are in the cervical? Cervical plexus. And then the next one's down. You see how they go to the arms? So this must be a network that goes to the arms, so that's the brachial plexus. In the textbook, they have a little bit nicer picture on Adam. It sort of splits it out. It sort of differentiates it, makes it a little bit better as well. There's no thoracic one. There's a lumbar plexus. This is the lumbar plexus. And all the way down is the sacral plexus. Some of the other nerves, if you have following, a nerve gets its name from where it's going. Where does Frederick Road go to? Frederick. Where's Rockville Pike go to? Where does Wisconsin Avenue go to? I'm just kidding. It's Rockville Pike. All right, anyway. All right. So here's the side. Remember my thumb? Remember, what's this side? What's this bone right here? Okay, so what kind of nerve is that?
Radial.
Radial nerve. And how about pinky? Remember, I'm doing it, okay? Raising the pinky. Radial nerve, ulnar nerve. I'm going to skip over a couple of these other ones. Just as a side note, musculocutaneous goes into the muscle, and cutaneous means skin. So those are these branches that are on the outside. Those are muscular cutaneous. I'm sort of skipping them. I haven't really lectured on them, and that's why it's not going to make that much sense at this point. There's a huge nerve, which I like to always point out, coming off this sacral plexus. See this huge nerve? Probably one of the monstrous, biggest nerves. You see this big nerve? And it goes all the way down behind the leg, all the way down underneath the foot, all the way to the toe. So sometimes people have their toes, or they say their backside is hurting or numb, and what do they call it? What does Grandma call that? Sciatica. And it's really, we don't call it sciatica, it's called the sciatic nerve that's irritated. And they'll have this distribution, their toes are numb or toes hurt behind the leg. A lot of times there'll be muscles that sort of crisscross this nerve and pinch the nerve. So if you pinch the nerve over here, guess what's going to happen down here? You're going to feel it down here. Have you ever banged the back of your elbow and you feel, wow, I just felt it in my ulnar region? So if you compress a nerve over here, it's going to feel like it's coming from over there. So that's what sciatica is. A lot of times the compression, maybe there's a compression where the vertebrae, the cushion in between the vertebrae has worn down over the years and is compressing that nerve. So that's the sciatic nerve. The nerve that's over the tibia, what are we going to call that?
Tibial.
And the nerve that's the common means both of them, that are over the fibula, what are we going to call that? Fibula nerve. Pudendal are these two nerves that sort of hang down. They're not really well described right here. These two nerves that hang down in the pelvic floor, so right down pelvic floor, sort of, can you say tushy in anatomy? In the tushy region. Tushy. These two guys right here. I don't like how this tushy. Everybody know what a tushy is? It's a gluteus maximus. Tushy, T-U-S-H-Y, tushy pelvic floor region. Let's see. How about the nerve that goes in right over the femur? What are we going to call that? Femoral nerve. Phrenic nerve we'll get to later on, but the phrenic nerve actually goes to the diaphragm. And what maybe after where it says phrenic nerve, put down Adam. Adam has a great picture of it, and its nerve goes right over the diaphragm. Remember, our diaphragm is a little flat muscle that's underneath the rib cage, and if that muscle spasms, a twitch, it's going to send a blast of air up, and what sounds do we make? Hiccups. So if the diaphragm flaps, sends air up. Those are those. Let's talk about the eye and the ear. I'm just sort of getting you a jump start on this. I haven't lectured on it, so I'll try to keep the high spots. All right, so I'm going to start off with him. Whoops. You're already starting off with an eye problem. All right, whoops. So there's a gland. Everybody point to the upper right near your eyebrow. There's a gland up here. And what do you think that gland does? It makes something that's very important. Tears. So that's called the lacrimal gland. So the lacrimal gland is associated on the lateral side of the eye, and it's going to make tears. 16. So it's 14 and 16. 15 doesn't have any practical structures. Okay?